Welcome to the IVF Journey with Dr. Michael Chapman, the podcast for couples who struggle with infertility and want to fulfill their dreams of becoming parents. In this podcast, you'll learn actionable strategies to deal with infertility from Dr. Michael Chapman, or Prof as he's affectionately known. Prof is the co-founder of IVF Australia and is a leading Australian infertility specialist who has helped over 3,000 couples realise their dreams of becoming parents. To access previous episodes packed with ideas, solutions and tips that actually work, head over to Dr. Chapman's IVF podcast on iTunes. You can also ask questions by contacting Dr. Chapman's rooms on 1-800-111-483 or by emailing him michael.chapman@ivf.com.au.
That first cry of a baby born after the long journey of IVF remains one of the most beautiful experiences in the world. As an obstetrician and an IVF specialist, I've had the privilege of experiencing this over many thousands of times in my long career, but I still remain moved by each baby's first cry. It signifies the end of a long journey and the beginning of a new life. This is Professor Michael Chapman, co-founder of IVF Australia and host of the IVF Journey podcast. Thanks for tuning in. To access all the previous episodes, head over to my website, www.theivfjourney.com, and select IVF Journey Podcast from the navigation menu. You'll also be able to find the various services that we provide at IVF Australia. Today we're going to talk about endometriosis. Endometriosis is an important issue in relation to fertility. It certainly occurs very commonly in the age groups that we see patients who are trying to conceive. Endometriosis is where cells that are similar to the lining of the womb embed themselves and grow outside of the womb. These cells, under the influence of the hormones of the menstrual cycle, grow and degenerate. And that degeneration, a bit like what occurs with a period, with bleeding and shedding, also occurs in these cells outside the uterus. It's that inflammation associated with that hemorrhage which causes many of the symptoms and ultimately the damage that can be done by having endometriosis. How those cells get there is still unknown. There are a number of theories. For instance, it may be that the cells flow backwards down the fallopian tubes into the abdominal cavity, retrograde flow that's called. And certainly with every menstrual cycle, if we do a laparoscopy and we're looking inside a woman at the time of her period, there's always some blood in the peritoneal cavity if the tubes are patent, open. If this was the cause, however, we'd expect every woman to have endometriosis, and that's certainly not the case. The second theory is carried into the surfaces of the abdominal cavity by the lymphatic drainage. And thirdly, the peritoneum, that surface layer which covers all the organs of the abdomen, has the potential to change its nature, differentiate into almost any sort of cell. So these cells may just have developed de novo from new. Whatever the cause, the problems of endometriosis are common. It is estimated that something in the order of 15 to 20% of women have endometriotic deposits. Many of these deposits are minor and do not interfere with fertility nor cause any problems. It is the more severe cases where the problems begin. The women most likely to develop endometriosis are women over 30 who haven't had children by that age. They tend to be in the higher socioeconomic groups, but that's probably because they've put off having children. They have careers. The symptoms of endometriosis are multiple, mostly associated with pain. The pain can occur with menstruation for the obvious reasons that I indicated before, which is that those cells shed and there is blood irritating the lining of the abdominal cavity, and that causes pain. That period pain is not like the period pain that young girls suffer. Young girls' pain tends to be for a day or so right at the beginning of the menstruation, and then while menstruation continues, it gradually tails off. That pain is caused by uterine contractions. Pain of endometriosis, however, often begins before the period, gets worse during the period, and tends to carry on after the period. You can get pain with endometriosis at other times of the cycle, although that is less common. The pain of endometriosis can be very specifically in the midline, but it can also spread throughout the lower abdomen. The next type of pain that is reported with endometriosis, usually associated with severe endometriosis, is the pain associated with intercourse. That pain with intercourse tends to occur with deep penetration. On deep penetration, the uterus can't move, and as it's pushed, it causes pain because it's pulling on other organs in the lower abdomen. This pain is called deep dyspareunia. Another type of pain that women with endometriosis involving the bowel can suffer is when they open their bowels. Quite severe pain, particularly premenstrually and postmenstrually. If you have any of these symptoms that fit the diagnosis of endometriosis, you probably should be seeing a specialist. Obviously, infertility is another symptom, and in any women with those symptoms that I've described, a laparoscopy as part of the investigation of the infertility is very important. The management of the endometriosis can be medical or surgical. The medical treatment involves medications, usually hormones, that mimic pregnancy, because in pregnancy, endometriosis does get better. Those hormones can be as simple as going on the oral contraceptive pill continuously, not having the 7-day sugar break, but taking 21 days, 4, 6 to 9 months. So we're trying to stop the periods. What happens in that scenario, just as it does in pregnancy, is that those cells, those endometriosis cells that are outside the uterus, degenerate and no longer active after ceasing the pill. This improves endometriosis in something in the order of 70% of patients. And certainly in the 6 to 9 months of treatment, not having periods provide amazing relief for women who've had menstrual pain associated with their endometriosis. More specific treatments with hormones have been developed, which include antiprogestogens, androgens, and androgens, male hormones. Mild male hormones also suppress the endometriotic cells. Some of these treatments are probably nearer 80% effective in improving the symptoms. Another time in life when women's endometriosis gets better is when they go through the menopause. No longer is there any estrogen to drive those cells to grow, and therefore periods do not occur. So inducing an artificial menopause is another approach to endometriosis. We have drugs that switch off the pituitary gland, and you can take them for 6 months, go through a pseudomenopause, and endometriosis will be improved in something like 80 to 90% of patients. The downside of this treatment, however, are the side effects. The menopausal side effects of hot flushes in particular can be very annoying. But for some women, it's worth the price to get rid of their endometriosis. The next approach is surgical. Removing the endometriotic areas can be done laparoscopically. The adhesions and scar tissue that's been formed can be divided and removed. These operations, particularly in the severe cases, can be long and time-consuming and even involve division of the bowel and reanastomosis, putting it back together again, to get rid of those nasty endometriotic areas. There are particular gynecologists who have developed extreme skills in this area of surgery. I certainly refer my patients with severe disease to these individuals. When a laparoscopy is done for investigation of infertility, small deposits can be removed by all trained gynecologists, but for the severe cases, I recommend referral on. Surgery will relieve symptoms in the vast majority, probably in the order of 80 to 90%. However, whether it's medical treatment or surgical treatment, improvement of the symptoms occurs in the vast majority, but for most, recurrence is common. Often not as bad as before, but the natural history of the disease over years is to recur. Thus, if endometriosis is treated and you're infertile, it's important to get on and get that baby. And that having that baby and carrying that baby will further improve the endometriosis and its symptoms. Sadly, many women suffer for the whole of their reproductive lives with the scourge of endometriosis and its symptoms. That pain that occurs can be debilitating and hugely interfere with your quality of life. There is now a subspecialty of gynecologists who specialize in pain management. And if you are one of those unfortunate women, seeking these guys out and getting good treatment for your pain can change your life. So endometriosis is common. It causes symptoms and can cause infertility. In most cases, it's treatable and improvements can occur. Children will be born despite endometriosis. And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey Podcast from the navigation menu.
Thank you for listening to the IVF Journey with Dr. Michael Chapman, the podcast which helps couples negotiate their way through the IVF journey, all the way to parenthood. You can also ask questions by contacting Dr. Chapman's rooms on 1-800-111-483 or by emailing him michael.chapman@ivf.com.au.